webinar will be dedicated to situations which refers to how important is oral health, and regardless of an age of our patients, so dogs, cats, how important is to not to neglect and to follow the situation in oral cavity. And this webinar is as much dedicated to pet owners as breeders or veterinarians or nurses or whoever has the pet with teeth and whoever wants to have oral health, maintain this oral health. I'm trying to minimize that one. Yep. And we can call also this webinar as a dentistry through life. So when you see the pictures on the first slide, it shows the story of one Jack Russell Terrier who belongs to my sister-in-law. And from the age of 4 weeks through 7 weeks, 3 months, 6 months, 1 year, 5 years, or 11 years. And each year we can find something important to look at the mouth and to identify potential problems, and if necessary, to help the dog. The same refers to cats. So let's talk how we can control, maintain oral health and prevent oral pathologies by implementing the prophylactic program for your pet. The lecture will include 5 parts. The first will describe the regular oral rechecks. So the concept of oral health index, very basic, very easy to perform project of oral health assessment and what we can get from it. Secondly, we'll talk a little bit about the plaque control and prevention at home. So what every pet owner can do at home regarding active and passive hygiene. Then I'll mention briefly the application dental index about the self-control. So what everybody can do to assess the oral health with a little help of an iPhone or something which can use the application. Finally, we'll discuss the concept of a regular professional dental cleaning, and in summary, we'll come up with some proposals. So that's the next hour. The first part is a oral health index concept. Why oral health is important and why it can be quite simple to assess the basic situation of oral health. This project had been supported by the WSAVA, by the Dental Standardization Committee, and it was dedicated to general practitioners. In fact, in my clinic, every general practitioner, every first contact vet is utilizing this oral health index. And I have to say that's a very important source of our patients, our dental patients. So this concept includes 9 minutes of investigation, 9 minutes of oral health evaluation. First 3 minutes is just a general, obtaining a general physical and oral history. You can use at this point either a questionnaire or simply talk to the owner. This discussion is about what's happening to the dog or cat, what important things are going on, whether or not anything is happening to the dog or cat in terms of oral health. Then the 3 minutes is a dental periodontal examination with in a conscious patient. So that can be somehow a limitation, because if the dog or cat will not allow for examination, then unfortunately will not be able to perform this. But most of the dogs and cats allow for this very basic examination and allows us to retrieve important information. Then finally, 3 minutes we dedicate for discussion with a pet owner and setting up the conclusions of this examination. So when you test, excuse me, I'll close the doors. When you assess the awakened patient, very important is how you do that. So you should have a good lighting, you should have a comfortable position, animals should have also comfortable position, and you look at the strategic teeth, you look at the strategic part of the oral cavity. So that's just a very basic superficial glance at the oral cavity, where you look at the gingiva, you look at the dental deposits, and you also assess the mandibular lymph nodes. So these 3 clinical criteria you have to look at: dental deposits, status of gingiva, status of periodontium, and mandibular lymph nodes situation. This oral health index had been published in 2006 when we have been doing a massive oral assessment in a very big groups, almost 45,000 of the dogs and 18,000 of the cats. So we collected these informations in this huge group of animals, and based on that we could assess that the scoring system, which we introduced, very basic, focus on lymph nodes, dental deposits, and status of periodontium, is significant for highlighting the oral health index. So every parameter which we assess can collect either 0, 1, or 2 points, normally penalty points. So if there are super clean teeth, no dental deposits, this is 0 penalty points. If it is up to 50% of a crown coverage, it is 1 penalty point. If it is more than 50%, then it is 2 penalty points. The gingiva condition, we can look in a 3 different ways. Either healthy gingiva, no penalty points; gingivitis, 1 penalty point; periodontitis, 2 penalty points. Signs of periodontitis are described, and I'll show you in a D4 pictures later on. So missing teeth, teeth mobility, gum recession, massive bleeding from the gingiva. These are the signs of a periodontitis. And then lymph nodes, you can palpate them. If they are tiny, hardly palpable, this is normal, 0 penalty points. Slightly enlarged, easy to palpate, 1 penalty point, and moderately to severely enlarged, 2 penalty points. So that's how we look at the clinical situation in the mouth. If there is no deposits, healthy gingiva, 0, 0. A little bit of deposits, healthy gingiva, 1, 0. A little bit of a gingivitis, but no deposits, 0, 1. A little bit of gingivitis and a little bit of a less than 50% of a coverage of a deposits, 1, 1. And then the next situation, you have 2, 0, respectively 1, 2, or 2, 2, 2, 1, depending on what is extension of a periodontal pathology and what is extension of a dental deposits. The same refers to cats. So you can see super healthy mouth, which I have to say is not easy to find a cat like that. So that's 0, 0. Then it is a little bit of deposits and gingivitis, 1, 1. Gingivitis, no deposits, 0, 1. And a little bit of deposits and healthy gingiva, 1, 0. And respectively, more advanced situation, more deposits, and more severe periodontal status, an extension of the problems. So that's finally you have a clinical assessment. At the top of these 3 parameters, we add 2 environmental parameters which you look at. which is a diet, nutrition, and extension of oral care, which means we ask the owner what kind of a diet the animal is being fed. If it is dry diet, there is no penalty points. Mixed diet, so dry and soft, it is just 1 penalty point, and the homemade or soft diet is 2 penalty points. The reason why we do that is proven benefits of having a dry diet to reduce the amount of plaque formation and calculus formation. So that is why we decided to use this parameter. When I'll explain you later on, it is not imperative factor of having oral health, but it can help a little bit as a passive oral hygiene mean. The second parameter is more important because oral care, if the owner performs daily brushing, this is 0 penalty points. If it is a passive hygiene, for example, 1 dental treat a day, or brushing every other day or once a week, then it's only 1 penalty points. And if there is no hygiene, 2 penalty points. So finally, 3 clinical parameters and 2 environmental makes the whole oral health index ready to calculate. And you see 5 parameters, maximum 2 penalty points, makes the range of our index between 0 to 10. So if the dog has no oral hygiene, is fed soft diet, has a periodontitis, has a lot of calculus, have an enlarged lymph nodes, is receiving 10 penalty points. But if it is super healthy individual, having daily brushing teeth, fed dry food, having no enlarged lymph nodes, has 0. So that's an ideal patient. And within this range between ideal patient and super diseased one, we found 3 stages. Between 0 to 2 penalty points, we recommend only prophylactic recommendations, and we recommend recheck in a 12 months time. Means you have a super nice dog or cat, no problems at all. So we only highlight the importance of prophylactic procedure and invite for the next recheck in 12 months time. If there is a 3 to 6 penalty points, so it is not really a pet smile, but it's a little bit confused pet smile. So we have to change radically the situation, possibly change prophylactic program, possibly change the diet, very likely advise surgery, and the further distance of a recheck is 6 months. And then finally, the worst situation, when there is a very bad oral health, we simply recommend the surgery, immediate surgery, and if nothing happens, we also invite for the next recheck in 3 months. So that's a simple situation, which helps a lot our veterinarians to advise the owners what they are supposed to do when they are supposed to show up with a patient. And this is the system which we utilize in every single patient, not only dental patient. So that's the first part of a lecture, which highlights the direction of a systematic dental oral recheck, which can be done by every single first contact veterinarian, or even by nurse, if the nurse is properly qualified. The second part of a lecture is to discuss the methods of oral hygiene. And before we'll start that, we have to highlight the importance of periodontal disease and plaque relations. So the periodontal diseases are induced, triggered by this soft accumulation on the tooth surface, which is nothing but bacteria. And these bacteria are inducing the inflammatory response of the host, causing first gingivitis and or periodontitis. And if you want to control periodontal diseases, both gingivitis, periodontitis, we have to control plaque accumulation. So the next part of our webinar is dedicated to how we control plaque accumulation. And before we'll discuss how to control, it's very important to explain the pet owner or somebody who has a dog or cat what is a plaque and how to identify the plaque. We can do that in a very simple way. So when we have this situation of a dog, we take a little bit of a swab, very clear swab, and we wipe the teeth, and then we show this soft deposit. This is plaque, and this is something very important to control, very important to remove on regular basis, on daily basis, sometimes even 2-3 times a day. That's important. Another method to identify the plaque, to see the plaque, is to use, for example, the UV torchlight or another kind of a lighting, which is fluoriding, which is changing and which is identifying and showing, exposing the plaque. That's very simple. We only have to turn off the light in the cabinet, use the light, and show the owner this reddish surface on a tooth, which is easier to not only to identify the presence of a plaque, but later on to monitor the efficiency of a daily brushing or other oral hygiene means. We can also stain the plaque. So there are disclosing solutions. We normally use this kind of a disclosing solution in anesthetized animals. And this red disclosing solution we cover on the tooth, and then we flush it with a gentle blow of the water, and whatever stays on the tooth surface, that's the same as we do in our kids in the kindergartens. Whatever stays on the tooth surface also shows the presence of a plaque. So that's something which help us to control, to visualize whether or not the plaque is present and how intensively plaque is covering the tooth surface. Then based on that, when we explain the owner what is a plaque and how to control, we can discuss how to establish oral hygiene. So first we should decide whether we should use the oral hygiene as a preventing method, preventing action, or it is curative action. And we have tailored the oral hygiene methods to the breed, to the temper of an animal, to the character of a patient. Also, we should look to the capacity of a pet owner. So whether or not she or he will be doable to perform brushing, whether or not she or he understands what is and how it is important to perform the brushing. We should also demonstrate that. We should discuss the dietary regime, nutritional supplements, and we have to spend some time to educate. At the moment of discharging the patient, it's very difficult to explain and to spend time explaining the importance of oral hygiene. So I strongly recommend and advise you to think about this kind of a discussion, not at the moment when we do some kind of a prophylactic procedure, but invite on a separate discussion 2-3 weeks after procedure, where we can quietly sit in a cabinet and discuss the need and the methods of oral hygiene. In general, there are 2 groups of oral hygiene. One is active group, second is passive. This illustration showing a bunny and a turtle shows here somehow illustrates how efficient and how fast progressing these two hygienic methods can be. So definitely active oral hygiene can be faster, more efficient, better getting to the desired point, but still passive hygiene is slower, maybe more consecutive, but still can slower get up to the desired point. And more precisely, the active home care is something which involves the pet owner and requires a hands-on. So owner have to manipulate something either with a toothbrush or with a cleansing gel or with other methods, and to interact with a dog or cat directly to remove plaque and control the dental deposits. Passive home care refers to all the other parts of oral hygiene, which normally are associated with the mastication, with chewing, with grinding of the harder diet by the dog or cat. So the active home care includes teeth brushing, application of cleansing gels, application of a barrier sealant. I'll explain in a moment what is it. Application of sanos, while the passive home care, diets, treats, water additive, supplements. Not only diets and treats are described by the Veterinary Oral Health Council, but also water additives and supplements too. So what is this VOHC? What is this Veterinary Oral Health Council? This is an institution which recognizes products that meets the standards of plaque and calculus control and reduction. And these standards are based on an evidence-based study which are performed by specialists. So in other words, if manufacturer produce a dental thread and claims this dental thread is effective for plaque control, the VOHC is organizing the studies, evidence-based studies, which are controlling in a group, representative group of dogs or cats with a blind control, with a placebo control, with randomized studies, and then studies lasting for roughly minimum 28 days, sometimes months, or 2 or 3 months. They show the difference between control group and the study group. And when the reduction of a plaque between the study group and control group exceeds 20%, then such a product is rewarding the VOHC plaque of acceptance. So you have a quite long and longer list of products which had been studied and checked and approved by the VOHC. So this logo here, VOHC accepted, is something which is very easy for the specialist or for veterinarians to recommend, because we simply don't recommend a certain product, certain manufacturer. We can approve this kind of, and we can recommend the products which have VOHC seal of acceptance. So that's the brief explanation about the VOHC. But let's go back to the active method. So teeth brushing, definitely golden standard of oral care. But look at that. Even the daily brushing doesn't reduce 100% of a plaque or calculus. 37% is something which is the standard reduction. So still, even if you do teeth brushing, means that you will still leave a little bit of a plaque and calculus. So that means you will still have to show up your pet, your dog, your cat, to the veterinarian to see what is the oral health condition. We also know that the teeth brushing is most effective in the rostral part of the mouth compared to the distal part. Why? Because pets don't like when you manipulate in the distal part of the mouth, when you have to retract the tongue. It's also said that the more effective teeth brushing is when you use together with the appropriate toothpaste. And for normal technique, which is recommended also in the veterinary patients, the modified bus technique is something which is recommended. So you can find in a YouTube or you can find in a textbooks how the modified bus technique should be like, or you can ask your own dentist. Sure, he will explain you, because that comes directly from human dentistry. Correct toothbrush, however, is a little bit different for the veterinary patients compared to the human patient. So I think I strongly recommend the toothbrush which covers both surfaces of the tooth, buccal and lingual. That speeds up the whole process, but it's requiring a little bit of a skills. So we can start with a standard toothbrush, a soft, smaller size, dedicated for kids. But in my opinion, this correct double-headed toothbrush provides a better control of both surfaces of the tooth during brushing. You can also use electric or even sonic toothbrush, because the technique is not that critical as much as the frequency. So the frequency is really the most important. If you do the regular teeth brushing, but this regularity is once a month, is not beneficial. Study says that doing that not less than 3 times a week, it's even counterproductive, because then you can only accelerate the gingivitis. So that's, if you brush the teeth, do that daily, regardless whether you do electric brush or sonic brush or manual brush. Another active method is oral cleansing gel. The one which had been nicely researched is the one which contains the oral zinc ascorbate, and that's something which can be applied in dogs and cats, and that gives quite good control of plaque accumulation and additionally enhance the healing process after surgical procedures. We can apply this cleansing gel in a different way. We can do the excuse me. We can apply that directly from the container. We can use with the wipes. We can apply that with the use of a fingertips. And what is important, it have to be applied on a regular basis. The studies which we are doing, which are comparing the efficiency, you can see here, are utilizing the staining solutions. So on the left side, you see the animal which had been using for 30 days the product. So you see that the surface of a stained plaque is significantly smaller than the dog on the right side, which belongs to the group of control. So control group and the product group are giving the same diet. Typically, it is a dry diet, but the product group is receiving gel or chews or a special diet, while the control group is only giving the dry diet and nothing else. And you can see that even not being a specialist, you can appreciate that the right dogs have significantly bigger plaque accumulation surface compared to the left dog. Another group of products which are dedicated for oral care is products which contains the chlorhexidine. I personally am a little bit reluctant to recommend that on daily basis. I think it's chlorhexidine as an antiseptic should belong to situation when we have a infection, oral infection. But for prophylactic, I would be a little bit careful with this. So, but after treatment of very advanced infectious oral disease, I think chlorhexidine is very useful. Plus, in all this situation where we have to control the periodontal diseases and we cannot offer stronger antimicrobials, like, for example, antibiotics. Why we are very careful with chlorhexidine? Because it can stain the teeth, it can change the taste. That is proven in human patients, so that it can affect the taste. And recently, study shows that it can be a little bit toxic for fibroblasts. So any regenerative procedures in oral cavity combined with the chlorhexidine can be a little bit conflicting. The barrier sealant, I mentioned the wax. It's simply the wax-like substance which we cover the teeth after prophylactic procedure, and that slows down the plaque accumulation. The similar action we can obtain with the use of a Sanos. Sanos is also dental sealant, and application of Sanos on the gingival margin of a crown slows down the plaque accumulation. And the result of this application is up to a month, 4 weeks, 28 days, while the previous, the wax is something only for 2 weeks. So depending on how long effect of a prophylactic we want to achieve, we use either wax or Sanos. Then the second group of a home care is a passive home care, and that refers to all the other parts of oral hygiene which are aiming to reduce the plaque accumulation, and they are concerned and associated mostly with using of treats, diets, or water additives. So there are studies, these studies which I mentioned here, which we've done on the dry diets, show that simply dry diet per se reduces the plaque accumulation compared to the control group, which in this case was a soft diet, by 10%. So it is quite significant. Also, dry diet decreases occurrence of mandibular lymphadenopathy, reduce the amount of plaque, dental deposits. Still, we can see that regardless of a diet, with age, the oral health index is getting worsened. But there are also special diets, dental diets. So not just a dry diet, but the dental diets which are focused on more significant and more spectacular reduction of tartar and plaque accumulation. These diets are normally dedicated for otherwise healthy individuals. So normally the dogs or cats with renal disease or with skin disease should be on a special diets, renal diets or skin diets. But if they are otherwise healthy and the only problem is the prevention of a periodontal disease, we can use a dental diets. And these diets are normally bigger in size, so the kibbles are bigger compared to the maintenance diets. And the very important is that the texture is allowing the tooth, and in this case, the screwdriver is mimicking the tooth, and the tooth is breaking the kibble after certain distance of penetration. So that allows the tooth for self-cleaning. That is the texture of this product, and that's the way it works during the chewing. While the typical maintenance diet, after any contact with the tooth, simply disintegrates very fast and breaks down. So that's the difference between the maintenance diet and the dental diet, which I think is quite important, because when you go to the pet shop, you see most of the products screaming that this product is good for teeth, reduces plaque, helps to maintain the oral health. So, but if you don't have any scientific background for that, it's just a claim, it's only marketing. So that is why it is important to follow this VOHC acceptance. And there are products, I'm not really oriented what is exactly in a Hong Kong situation, but at least these products had been awarded in Europe from these 4 major manufacturers, and we can find in all these products certain kinds of a diet dedicated for oral health. These are the dental diets. Of course, the treats, chews also have VOHC seal, and this is on the right side. You see the long list of the products which had been awarded by VOHC, and these products not only are dedicated for plaque accumulation, but also VOHC takes care about providing the safety test of this product. So none of these products should cause indigestions or other side effects. So that is why it is worth following this kind of recommendations. Dental traits are sometimes based on the features, the dental prophylactic features are based on the texture, but also can be covered by special compounds, chemical compounds, or can be coated with hexametaphosphate, HMP, which reduces the concentration of a free calcium in saliva. So in this way also can reduce the speed of calcification of the plaque, and as such reduces the accumulation of tartar. We also have quite some studies dedicated for dental chews efficiency. So you can find that even on the teeth which are not really involved in chewing, like in here, the canine tooth, when we give the chew, it can reduce the accumulation of the plaque or tartar. And that's something very interesting, because we normally always should expect that the teeth which are involved in mastication, in chewing, are typically the ones which are the most beneficial. But as you can see in this situation, these dogs, I think it mostly because they had been really keen on very palatable dental chews, you can find that even the results on the front teeth, which are not normally involved in a mastication, have been also resulting in improved quality. This result is more curative result. Previously, I showed you the clean model studies, and this is a non-clean teeth model study, which shows that how certain chews can reduce the existing plaque. So that's also interesting, and you can find in the dental literature description of this kind of a product. Also, you can have, I don't know, again, whether it is available in Hong Kong or in Asia, but a healthy mouth, this is a solution which you add to the water, and that's the helping and the curative result after daily administration to the water or to the food. Water additive, a little bit different than the healthy mouth, which had been published this study last year. It's very good, specifically in individuals which have very strong inflammatory response. However, well, your dog or cat has to drink water. If your dog or cat loves tap water, unfortunately, the water additive will not be effective, will not be working. But if it is available, and if your cat or dog will not complain with a changed taste of the water, I think it is also a very good addition. And that's the study which we've done with the water additive. Again, on the left side control, on the right side product. And without staining of a plaque, you don't see the difference. But after you stain the plaque, you see significantly less plaque being accumulated on the product group. So that's also rewarding, and this product had been rewarded by the VOHC. This is an interesting product because it has systemic action. Adding this ascophyllum product to the diet changes the saliva. So saliva, what we've done, the study first showed that it reduces the plaque, but we didn't know how. So we collected the saliva samples, and you can see that between the day 0 and day 30, there is a significant difference in a metabolomic content of a saliva just between the control group and the study group. Interestingly, on the left side is the group which didn't have a product, only received the dental cleaning, and you see that also dental cleaning changes saliva in these patients. So that's surprising. But we also could find that despite dental cleaning, addition of ascophyllum, also you see the group of a study group and the group of control have very different saliva. So that's the direction which is also very interesting for the prophylactic addition. So you see that we currently have quite a lot of products which are useful for daily home care. So what else can the owner do? This is an application, the Dental Index application, which you can find and you can have in your iPhone. And in your iPhone, that can be one of the million apps you have. And how it works. The concept is similar to Oral Health Index. And once you register, you can use, and from the left to the right is just step by step how this application works. So first register your patient, then you look at the teeth, and then you have example pictures. So you can assess the plaque accumulation, tartar, the stage of a gingivitis. Then you can even upload the image of your pet. And finally, you receive on your email address the report about the plaque accumulation, tartar, and recommendation. This is a report about my daughter's cat, Marcel. He's a Devon Rex. He's, well, a little bit slow, but he's a very nice cat. He doesn't have all the teeth. You see that his P3, P4 are missing, but his oral health is quite efficient. So the only recommendation he received was just a dental foot and regular teeth brushing to be continued. So that's something nice because not only you can have this moment of assessment, but you can also do a follow-up. And if you allow this application holder to register your database, you can also use that for the future rechecks. So that's quite simple, and I also encourage you to use it. And now the last part of the webinar is a few words about the professional dental cleaning under general anesthesia. Professional dental cleaning can be only done under general anesthesia and intubation because otherwise it might be very dangerous. Dangerous not only for the quality of what we do, but also for the patient. Patient can get pneumonia, patient can be hurted, patient can be receiving non-accurate dental cleaning if it's not relaxed, if it is not 100% tolerating what's going on in the mouth. And you see during the professional dental cleaning how massive amount of liquids we are using. chlorhexidine flush, water flush, Ringer's lactate flush, gingival sulcus lavage. It all have to be performed in a very safe way. And then on the right side, you see the starting point and the ending point. To receive and to achieve this ending point, you have to spend some time with your nurse or together with your nurse to achieve this quality of action. And what you do, you have to take care about the infectious risk, not only about yourself and your nurses, but also the patient. Patient is sleeping, has to be covered, has to be isolated, have to be intubated. And then you can, despite, regardless whether it is a dog or cat, you have to take care about this infectious risk. Sometimes the infectious risk is very low, which we have in pediatric dentistry, but the older and the more complex the patient have oral problems, the more we have to take care about this infectious risk. Mechanical scaling is one of the critical part of a professional dental cleaning, and it is not the purpose now to teach how to do that, but you have to take into account that it has a certain part of standards which you have to fulfill. The way you handle the handpiece, the way you apply the power equipment to the tooth surface, the way you use the relation of a working tip to the gingiva. It's all very important and requires, and I strongly recommend you to take part in a good professional course, being in a workshop, to be supervised rather than looking at a TikTok or YouTube classes by somebody who doesn't really show you the important details, because then you can do horrible mistakes during this procedure, and that's not to make this procedure, but to make it properly. So all these details, how to use, how gentle you should be explained and hands-on explained and being supervised at the workshop, practical workshop, rather than on webinar. So I only highlight that today. But that's the example. So once you perform this kind of a scaling, you see how gently we are. We do not apply any force. We touch the dental deposit with a vibrating scaler to disintegrate the calculus. We cannot spend more time than like several seconds per tooth because we can deliver too much of energy. We have to be very careful and we go around the whole tooth. Then we have to, after that, once we descale, once we remove the tartar, we should polish. There are some controversies about the polishing, but the most important is that, again, not to exaggerate with the power equipment, but only gently smooth the surface of the enamel, which normally during a scaling, regardless whether manual or mechanical, can be a little bit roughened. So don't exaggerate with energy. Use a fine grit of a polishing paste. Apply the light pressure and do not exaggerate with the rotation per minute. So maximum 4,000 rotation per minute is applied. And that's the result. Even after very delicate manual scaling, the surface of enamel can be roughened, can be scratched. So that's before polishing, that's after polishing. The same mechanical scaling can be really harmful for quality of enamel. That's before, that's after scaling. So important, but very delicate, and do not exaggerate with extension of that. What additionally we can do after a dental procedure is the complex work, focus on either prevention of the development of a hypersensitivity of the teeth, so fluoridation. We can either apply that generally, so apply the fluoriding foam in the mouth and then wipe it dry, or we can locally apply the fluoride varnish directly to the teeth, and that procedure I would recommend in the situation when you have gingivitis and you don't want to allow for massive absorption of toxic, otherwise fluoride. So then we use a topical varnish, fluoriding varnish in a selected teeth. If we don't have a problem, we can apply if we don't have a gingivitis problem, we can apply the fluoriding foam in the whole mouth and then wipe it dry. We also can apply one of these products which I mentioned before. So the barrier sealant, either wax like in here or Sanos like in upper pictures. That will prevent the immediate plaque accumulation right after our dental procedure. Okay, and now we'll be finalizing because, well, we've been talking that this webinar will be around 1 hour. So what we can propose for our pets in the different 3 episodes of life. So the pediatric dentistry, the mature patient, and geriatric dentistry from the veterinarian and the pet owner perspective. So for the first group, the puppies, developmental time, developmental dentistry, what can you use the opportunities are the breeder's control. So when the young puppies are under control of a breeder and the veterinarian, together with a prophylactic program, together with the vaccination, together with the deworming, and then at the neutering moment, what we do during this time, we identify certain hereditary disorders, developmental disorders, we assess the occlusion, we identify the teeth number, whether or not there are any missing teeth, we see what is the eruption process, whether it goes smoothly or there are any discrepancies in that. And if necessary, we perform all the group of interceptive orthodontics, so any preventive extractions of teeth which can interfere with oral health. So that's the developmental time where we specifically should be focused on developmental hereditary disorders and occlusal problems. Then the second group is a mature, so that the opportunities includes the annual rechecks, so the moments which we invite. You remember from the oral health index, the most rare rechecks, we recommend 12 months. So we don't say, come with your pet when the problems start. No, show up every year, then we'll be able to control and to provide immediate action if problem starts. So standard cohort should be on annual basis. Sometimes, if we see that the daily brushing is very good, home care is perfect, we don't have to do every year. But then the minimal frequency would be maybe 2 years, depending on the quality and the condition of the dog or cat. Also, we can use other anesthesia opportunities. Unfortunately, problems happen and anesthesia, general anesthesia associated with other things, not associated with oral cavity, can also be used for at least rough orientation of what's going on in the mouth. In our clinic, our surgery department is very sensitized for oral cavity. So whenever they do general anesthesia, at the moment of intubation, they inspect oral cavity. And in case of something problem, they always call myself or my resident to show that, you listen, this is a problem. So once we are done with what we do, what do you think when we can refer this patient to your department? That's very important also, this control, systematic control in the working dogs, police dogs, military dogs, custom officers' dogs, guiding dogs. So all these dogs which are, or dogs which are using for dogotherapy, these guys really have to be under very systematic control. And then we can use the oral health index status identification. We can use dental index. We can always focus and identify the findings and setting the proper appointments. Finally, senior dog care, geriatric dentistry. We already know that the dogs, cats, they live longer and longer, and they need really a good care also for the oral cavity problems. So we invite them for annual rechecks. We do follow-up. We know these patients for years, so we can offer them the good care and the good proposal recommendations for the maintaining of a life comfort and oral comfort. Any qualification for anesthesia or other surgery also require oral recheck. So then for that, interventions, definitely the periodontal diseases prevalence is growing with the age, but also quite often the oral health will help to control and to maintain and to manage other chronic inflammatory or immune-mediated diseases like diabetes, heart failure, chronic kidney disease. So we never say that this patient is having kidney disease or having diabetes, so we can't do any dental procedure. No, moreover, this diabetic patient or kidney renal patient requires good oral health. So we can qualify, we know how to anesthetize safely these patients, we know how to help them. We also do sometimes palliation, so something to relieve a pain, relieve infection is also common and popular help in geriatric patients. This is an example. So we have a Yorkshire Terrier patient at the age of 8 years. The upper one is the one which shows almost every year and is providing a good daily home care. And you see here that, okay, he has some calculus, he has a gingivitis, so that's the time for the next prophylactic procedure. But compared to the lower patient, which had been presented first time in his life for cohort, you see that very likely this dog will receive 1, 2, 3, 4, 5 teeth extraction because that's too late, and too late for controlling the periodontal disease. So both dogs at the moment of presentation have similar number of teeth, but this one will receive cohort and will be still a happy owner of a complete dentition, while this one will lose, unfortunately, 4 premolar teeth because or one molar tooth because it's too late to preserve these teeth just because of a lack of a proper prophylactic program. So what we want to summarize today is, first, think about the oral health program as a part of a welfare program for your pet, for your patient, for your friend, for your customer. That includes not only professional dental clinic, but also regular rechecks and a good establishment of oral hygiene. And for those who want to focus more on the oral hygiene, definitely the best selection is to combine the active and the passive modalities of home care, and strongly recommended following the VOHC seal of acceptance. All right, so that's the content of webinar.